Guatsurdio, or Good Medicine Clinic in Akwesasne. Before we begin important ceremonies or meetings, we do an acknowledgement called the Ohando Gardiwadekwa, and these are the words that come before all else. In effect, the words are an acknowledgement of the following. Everything was created with its own original instructions. Everything has a right to exist and carry out those original instructions. Everything that we need is provided for by our mother, Yatinistaha Umhutsage. Ongwehunwe, the first people, are stewards of the lands and the waters and the great balance or homeostasis that exists. We are grateful that our mother, Yatinistaha Umhutsage, provides for everything that we need, and we acknowledge our planet, animal, and celestial relatives. Regarding disclosures, I've become involved with many organizations, both as a community member and as a board member. At these communities and boards, I provide a community, Indigenous, and health perspective. I lecture at the medical schools of McGill, the University of Ottawa, and Queen's University in Canada. I have residents and medical students who come to Akwesasne for their 1 month rotation, and I have no financial disclosures. It is very important to reflect on where we come from. We all have incredible people in our families, past and present, who have an indirect guidance to the way we think about things.
Ojistoh, can I ask you, you share the screen, but also with the notes and the next slide. Could you share the screen with just your presentation or just your slides?
Yeah, I guess I can't because I'd have to read it. I can't read it. So what I'll do is I will read it from a paper. That's fine. That's fine.
Whatever you want. Yeah.
That's okay. It's very hard to do this when you realize that I'm the one, you're all looking at my slide. Okay.
Yeah.
So
it's fine, but we cannot see the pictures so good. Okay, thank you.
Oh, you want to see the pictures? Okay.
Yes, the slide. Yeah.
Use slideshow. There we go.
That's it. That's great. Thank you.
Yes. So it's important to reflect where we've come from. We all have incredible people in our families, past and present, who have provided direct and indirect guidance to the way we think about things. In my family, I am very fortunate to have strong community political and cultural activists, grandmothers and aunts who knew and practiced the plant medicines and midwifery, and those who were organizers of the provision of health. My work is informed by what I've learned from my family and my community and the experiences of learning and practicing Western medicine. I am accountable to all of my family. The objectives of this presentation are as follows. To briefly describe the Indigenous roles in the discourse of biodiversity, healthy environments, and planetary health. To briefly describe how healthy lands are related to healthy people. To describe the health of Akwesasne's land and people, and to demonstrate 3 community engagement projects. In 2015, the Stockholm Resilience Center posited that there are 9 planetary boundaries, one of which is biodiversity loss and species extinction. At the COP15 meeting last year in Montreal, the international goal was set for conserving 30% of the planet's biodiversity by 2030. It is recognized that 85% of the world's biodiversity is under the stewardship of Indigenous people, who make up only 5% of the world's population. This infograph describes gray zones, showing where there has been a loss of biodiversity concentrated in the south, where the large cities of Canada are situated. The light blue shading indicates intact forest cover, and the dark blue shading indicates intact ecological areas. Indigenous communities are illustrated as red dots and occupy all areas of Canada, importantly in the northern biodiversity intact areas. There is an increasing role for Indigenous people in the discussion of environmental health and biodiversity stewardship. Indigenous people are caught between the competing needs of the economy and continuing stewardship of the lands and waters. Indigenous people in Canada aim to hold their governments accountable to their own declaration and laws, including the Constitution and the United Nations Declaration on the Rights of Indigenous People. It's been reported in countries around the world that when Indigenous people protect their lands, they often encounter many political stresses and personal dangers. There are many definitions of health, and from our perspective as Haudenosaunee Iroquois people, good health requires having a healthy mind, and a healthy mind requires having a healthy spirit or a personal fire. Healthy spirits are supported by good relationships with others and with the land, the water, and the ice. Our minds are connected to the lands, the water, and the ice through our language. If the lands, water, and ice are not healthy, then the people are not healthy. Canada recently recognized that Canadians have a legal right to a healthy environment. Having a healthy environment requires the protection of biodiversity. Biodiversity is one of the 9 planetary boundaries. Excuse me. These boundaries are well illustrated in this infographic, first published by the Stockholm Resilience Center in 2015, and they are biodiversity integrity, climate change, novel entities, stratospheric ozone depletion, atmospheric aerosol loading, ocean acidification, biogeochemical flows, and the disruption of the phosphorus and nitrogen cycles, freshwater use, and land systems change. Biodiversity stewardship happens at the community level by people who best know the local environment, and individuals can place their efforts effectively at the community level. Akwesasne is one of the 7 Mohawk communities, or Kahnawahere communities. We're part of the Haudenosaunee Confederacy, and we're dispersed on either side of the Canadian-United States international border. Akwesasne is directly bisected by this border. And like many Indigenous peoples' lands that have been bisected by colonial borders, there are many jurisdictional issues. But the flow of water, air, and pollutants does not respect these boundaries. Unfortunately, corporations can be protected by the confusion that these boundaries create. In the 1950s, a very large dam was placed on the St. Lawrence River, which we call Kahnawahere, or the Great River. This dam provides cheap electricity for large industries marked with red stars in the map in the lower left. These industries, being upriver and upwind of our community, massively polluted the air, water, and the lands. And at one point in our community, we had the dubious fame of being the most polluted place in Canada. Noticing that the fish, bees, dairy cows, and plants appeared to be sick, the community asked for help. As a result of our pleas for help, there were many research studies conducted between 1986 and 2013. These were collaborations between the community and universities, and participatory research protocols and ethics guidelines were designed. The first study, initiated by Gudgie Cook, a midwife and my auntie, was to assess the safety of breastfeeding. This infographic, published in 2022 of November, describes these studies, which looked at breastfeeding, PCB biomarkers, cognitive and behavioral indices, and measures of thyroid, metabolic, and reproductive health. The studies can be summarized by the following quote by Gudgie Cook. By contaminating our food chain, including mother's milk, with toxic compounds such as PCBs, dioxins, DDT, and many others, corporate society has removed from us our very ability to feed ourselves, our families, and our communities. Exposure to toxic contaminants in the environment, the air, water, soils, local fish, local food, and mother's milk has resulted in a rapidly changing epidemiology among many Native people. So 70 years since the initial exposure, I now work as a family physician at the Kahnawahere, or Good Medicine Clinic in Akwesasne. We don't have community-specific data, which is a problem in most Indigenous communities. I had previously worked for 7 years in Kahnawahere, a sister community with a common history and culture. In Akwesasne, I have noticed an anecdotally high prevalence of depression, diabetes, dysthymia, dementia, autoimmune disease, thyroid disease, and cancers. This is an infographic by Homeless Hub regarding the social determinants of health of Canadians. As shown in green at the bottom, only 10% of illnesses can be accounted for by environmental factors. But we don't typically measure these associations, and we don't well teach our medical students to do a good environmental history during clinical evaluations. So I do question that number. In the light blue area, only 25% of illnesses can be attributed to poor access to healthcare. In the red area, the social determinants of health account for half of illness. Importantly, being Indigenous on its own is a risk factor for illness. But mitigating the negative determinants of health are the positive effects of community belonging and social safety nets. Importantly, having a healthy relationship with nature is not measured. In this article published in The Lancet earlier this year regarding health and global diversity governance, it is stated that biodiversity and environmental stewardship needs to be better integrated into local health systems, such as through radical listening methods, nature prescribing, regaining human awareness of interconnectedness within nature, and intergenerational learning practices, and by directly funding interdisciplinary biodiversity health work in communities. So I will describe some examples from Akwesasne. Since the 1990s, the ash borer beetle, an Asian beetle without natural predators, has been found in northeastern North America. This beetle kills 99% of the ash trees that it contacts. Ash trees have been used for basket making and are a very strong part of our community culture. Basket making keeps families working together, passing on knowledge, language, culture, and stories. Not only do specialized baskets carry very specific functions, like removing the outside husk from white corn, which is one of our traditional foods, but families have remained self-employed by making baskets. Harvesting the ash trees to make the splints is physically demanding work, and weaving the splints into a basket maintains hand dexterity. During my home visits, I happily find several elders still actively engaged in weaving baskets in their homes. So a community task force was created to find ways to deal with the problem, and one of the programs included removing or culling all the ash trees, embarking on a massive scale the teaching of younger generations all aspects of the craft, harvesting and storing seeds and planning their replanting when conditions were favorable, like in 30 years. There was also a discussion about planting ash trees on islands that were very far from the mainland because ash borer beetles can only fly 1 kilometer. But unfortunately, not all aspects of the plan were realized due to often financial considerations, but many aspects of the plan have been realized. In 1985, the health of the water and land was found not to be safe, and limits to fish consumption, home gardening and farming, and recreational activities such as swimming were not advised, and interactions with the land and water were subsequently diminished. In 2022, researchers from Carleton University, in association with the Native American Traveling College, did a novel project. Elders were paired with teens, and using drones, they looked at areas in the community that were once fishing sites, camping sites, swimming holes, and describing their place names in our language, telling stories about the past, mixing many, many sectors of this problem together in a very unique way. Around the world, birth was removed from the wise women of communities and placed into the hands of Western medicine practitioners, resulting in a lot of direct and indirect trauma experienced by our women, babies, families, and communities. Decolonizing birth and reclaiming body sovereignty involves reinvigorating relationships with each other, the land, and the future. In Akwesasne, one midwife, with the support of the National Indigenous Council of Midwives, has created a midwifery service in which women are supported by a team of practitioners, including family doctors, nurse practitioners, and obstetricians. To coordinate the research and programming that is occurring in Akwesasne, a community health board was formed, consisting of community members who have returned from their studies at colleges and universities, Those who've worked in communities providing programming and policy work, and those who have traditional medicine and cultural knowledge. These were all groups that all came together to form a community health board with a core group carrying increased research literacy. These include ensuring data sovereignty, meaningful participatory relationship building, and using Indigenous methodologies such as our Gaswanta or Turo Wampum, and Indigenous futurism, such as being accountable to the faces of those yet unborn or the faces that are yet to come, who are our future generations. In conclusion, Indigenous people have worldviews that include strong relationships with the land, the water, the ice, the air, and all beings that they support. These relationships are epitomized by the practice of reciprocity, keeping the great balance. Indigenous people have a profound mistrust of those who have the mandate to protect, for instance, the government, the police, and in many cases, their own community elected officials. When Indigenous people hold governments and corporations accountable to agreements and laws, many are often met with resistance or are gaslit. Indigenous people are being asked right now for their knowledge to mitigate biodiversity loss. Engagement will have to be organized with a very careful evaluation of responsible representation. Community representation will have to explicitly maintain accountability to the land, the community, and future generations. Individuals selected by non-grassroots means risk losing their community legitimacy. We all have an interest in securing the future of organized life on the planet. We want to leave our children with opportunities and lives that are fulfilling, wholesome, and based in healthy relationships. Nyamako, thank you very much. And I have my references here, which are that can be looked at later. Thank you very much.